In mental health nursing, you often don't have time to stop and flip through a textbook. You need to think on your feet. You need a playbook. So that's what we're going to do today. We're building that playbook, turning tough questions into a guide for making the right call when it matters most. Let's get right to it.
So here's how our playbook is laid out. It's got 5 main chapters. We're going to start with the absolute non-negotiable foundation, safety. Then we'll get into the tools of the trade, communication. After that, we'll navigate the tricky rules of rights and responsibilities. We'll see it all come together in a crisis. And finally, we'll dive into what fuels it all, the nurse's mindset. First up, safety. Seriously, this is the bedrock of everything. Before you even think about a therapeutic conversation or long-term planning, every single action you take has to start and end with one question. Is everyone here safe? Okay, let's put this into practice right away. Picture this. You have a client on lithium, a really common mood stabilizer. You notice their urine output has suddenly dropped way down. Why do you need to treat this like a 5-alarm fire?
Well, it's because this isn't just some minor side effect. It's a massive red flag for lithium toxicity, which can be fatal. This right here is a perfect example of a core rule you can't forget. Mental health care is physical health care, and an urgent physical need, that always comes first. All right, so what about something that's purely a psychiatric symptom? Let's say a client tells you they're hearing voices, and those voices are telling them to do something. What's the immediate play here?
The play? You report it. And you report it immediately. Command hallucinations. These are voices that are directing a person's actions, are one of the biggest risk factors for harm, either to themselves or to someone else. Your job as the nurse is to spot that danger and get the whole care team involved right now.
So let's just quickly recap the first page of our safety playbook. Rule number 1, life-threatening physical issues always win. Prioritize those. Rule 2, you've got to be constantly assessing for any risk of harm. Rule 3, know those high-risk symptoms when you see them. And Rule 4, and this is a big one, always start with the least restrictive option first.
So we've established that safety is the goal, right? Well, how do you get there? What's the main tool in your toolkit? It's communication. It's how you build trust, how you get information, and how you can de-escalate a crisis before it even starts.
Just look at the difference here. It's night and day. On the left, you've got that classic non-therapeutic advice. You should. But look at the response on the right. It doesn't tell the client what to do. It affirms their autonomy, their rights. That shift from directing to empowering is absolutely fundamental. All right, now for one of the toughest, most high-stakes communication challenges you'll ever face. A client says to you, "I don't want to go on living." How do you respond in a way that is both therapeutic and gets right to that immediate safety risk? You have to ask the question directly. Have you thought about harming yourself? Now, I know it might feel blunt, but it is the single most important and effective thing you can say. It's not judgmental, it avoids giving false reassurance, and most importantly, it opens the door to directly assessing their risk for suicide, which is, you guessed it, our number 1 safety priority. And all of this brings us to this ethical tightrope that nurses have to walk every single day. You're constantly walking this line, balancing a client's individual rights with your professional and legal responsibilities. A huge piece of this is advocacy. It's about helping clients get what they need while fiercely protecting their right to call their own shots. So, for example, if a client wants to refuse a treatment like ECT, your role as their advocate is to make sure that choice is heard, it's respected, and it's honored. But there are limits, and the duty to warn is probably the most critical exception to confidentiality. If a client makes a credible threat to harm a specific person, you have a legal and ethical duty to break confidentiality. You have to protect that potential victim. This is that really critical moment where your responsibility to public safety actually outweighs the client's right to privacy. All right, so we've got the plays, we know the rules. Let's see how this all comes together in the real world, in the middle of a fast-moving crisis. Here's a scenario you'll definitely see. A client in the middle of an acute manic episode. I mean, they have so much energy, they are literally in constant motion. And because of that, they haven't been able to sit still long enough to eat a proper meal in days. So, what's the play here? How do you handle this? Well, first, you recognize the physical danger. Severe exhaustion and dehydration are right around the corner. But the solution isn't to try and force them to sit down. The clever solution is to adapt to them. You provide high-calorie, high-protein finger foods that they can eat on the go. It's a brilliant example of creative, client-centered care. And you know, that same kind of smart, creative thinking is absolutely essential in dementia care. It's really a series of small, practical plays that make a huge difference.
You approach from the front so you don't startle them. You use symbols to help them find things. You put locks down low on doors to help prevent wandering. You go for a walk before bed to promote sleep. See? Every single one is a simple, practical, but deeply compassionate move.
And that brings us to our final chapter, which might just be the most important one. We've talked a lot about what to do, but it's just as important to talk about how a nurse thinks, that internal mindset that truly makes all the difference. You know, this quote from a nurse's own reflection, it just says it all, doesn't it? The real learning isn't just memorizing a bunch of steps. It's this deep, personal aha moment about why safety and setting priorities are so incredibly important. It's about making the playbook a part of you.
And that really gets you thinking about a bigger question, one that applies to any professional, but especially a nurse. What does it actually mean to be a lifelong learner?
It means you're never done. It means you're always reflecting on your own practice, looking for ways you can improve. And a huge part of that growth is shifting from being reactive to being proactive. That's the real level up, right? Learning to anticipate what a client needs before it turns into a full-blown crisis. And that brings us to the very last page in the playbook, the one that ties it all together. After all the critical thinking, the assessments, the quick interventions, what's left? It's this simple, powerful commitment. The expert mindset never, ever loses sight of the human being in front of them. And that means the final play is always the same. Pay attention to their pain and be compassionate.